Good morning. My name is Nancy Dollenmeyer. I am a physical therapist with Mercy Therapy Services. I have worked for Mercy for over 10 years now. I have been MS certified since 2009. I've been involved with several programs at the MS Center as well as through the MS Society. I have the MS Society, some of the projects that I've been involved in over the years. I have helped with the Free from Falls program. I have done several wellness fairs, and I also gave a presentation to personal trainers to help educate people more about MS with exercise. I wanted to include a couple of pictures. I think that makes it more interactive and more personal. I have taught the MS exercise class for Mercy for over 10 years now. It's a really fun group. You know, certainly we do exercise, but I will say that it is definitely more of a social experience. It gives you a sense of community. We just have a really good time. It's been one of the most enjoyable parts of my career as a physical therapist. And I'm very lucky that my supervisors have allowed me to teach this class 2 days a week. We meet Tuesdays and Thursdays, 10 to 11 in the morning. I do want to also let people know that with the MS exercise class, one way that we've really changed class over the 10 years is that we've opened it up to all levels of ability. It used to be where we would kind of categorize and try to fit different ability levels, but we let everybody in. We have people with scooters, wheelchairs, walkers, no devices. We welcome everyone. So I also want to mention that I feel very lucky given my role at the MS Center. We work with an exceptional team of neurologists and nurses that are huge therapy advocates. And as a lot of you know, not all doctors and nurses are big therapy advocates, and we're very, very fortunate in that respect. Some of our objectives for today, we've heard a lot about pain and the different types of pain, so I won't go into a lot of detail regarding different types, but we'll cover a little bit. But I do want to talk about both conventional and less conventional treatments given by physical therapy to manage MS pain. I want to give clinical examples, some of the patients that I've seen in my practice, different types of pain that they've had, and successful treatments that we have found together. I'm also going to market several of our services for Mercy Therapy. We have a partner in MS Care agreement with the MS Society. And with that being said, we offer quite a few services within Mercy to treat not only pain, but many different types of MS-related disorders. What is pain like for a person with MS? I think we've heard a lot about that this morning. The definition of pain: physical suffering or discomfort caused by illness or injury. Main types of pain. I know we've all used, between myself, Dr. Rushway, Dr. Green, talked about different categories of pain. Primary pain as a direct result of an MS lesion. Secondary, indirect, that talks about different orthopedic, skin, musculoskeletal changes that you might see. We haven't discussed acuity of pain. There's a lot of differences on the length of time that I've seen with the different types of acuity. But in general, acute pain is pain that lasts usually less than 3 months. Subacute might be that 3 to 6 month period of time. And then chronic pain is more 6 months or greater in general. Chronic pain is a problem. It's persistent. It's pain that is beyond the expected range for healing. And it also usually starts to involve the limbic or the emotional system. One thing we haven't necessarily discussed today, if I feel that my patient, if we're not managing their chronic pain well, I want to refer them on to other services. And I will not hesitate in helping people find different counselors or psychologists to also get involved in their care as well. All right, why do we care about pain? Pain is our natural response. It's a protective reaction for our body to tell us that something is not quite right. We need to do something about this problem. Pain trumps everything. When we have pain, it's overwhelming. You can't think straight, you can't focus. It's hard to do much of anything because the pain can be very overwhelming to us. It is always a clinical goal for a physical therapist or an occupational therapist. One thing I also want to bring up today is that with our, we do use the pain scale. I know we talked about earlier, there's many different ways to help us see where is your pain, describing your pain, what alleviates it, what makes it worse, where is it located, what type of pain. We definitely use the analog, the 0 to 10 scale quite a bit in therapy. And as a short-term goal or a long-term goal for therapy, is it always our goal to seek 0 out of 10 pain? No. We want to be reasonable. If someone has had chronic pain for years, going from a 7 out of 10 pain and getting to a 2 out of 10 pain, is that success?
Oh, yeah.
I think it is. I think a lot of people would agree with that as well. It's one of the main reasons people seek medical attention. And one of the big messages I want to send home with people today is that I really encourage people to take a proactive approach. It really hurts me inside when I hear people say, it's something I just live with. We always ask people about their pain, even if they're coming in for different reasons. And I want people to know that we're going to try to work at this together. So a list of some of the common MS-related pains, this is not all-inclusive, that are more commonly treated by physical therapists: burning, aching, hypersensitivity, spasticity, weakness and deconditioning are certainly some of the big ones. Poorly fitting and improper use of equipment and devices, postural impairments, body mechanics, gait abnormality, leading to repetitive strain or asymmetries, dysthesias, paresthesias, trigger points, and tender points. So you can see this lady here who's standing with good posture and bad posture. Does it kind of make you feel slightly painful when you see her in that flex position? It makes you want to fix your posture. In fact, if everyone wants to kind of fix their posture, right now I was like sitting in the back of the room, I'm always watching, everybody, that's what we do as therapists. Feel free if you need to scoot your hips back in the chair, rotate your pelvis anteriorly, use that backrest, kind of shift your weight a little bit. This is probably a good time to do so if you haven't done so already. So other MS-related pain syndromes that are not as commonly treated by physical therapy but can be trigeminal neuralgia. We've used different types of breathing relaxation training, diaphragmatic breathing. If you're familiar with diaphragmatic breathing, over time, most of us start to breathe very inefficiently. They always tell you, look how a baby breathes from their belly. They have the most efficient breathing pattern. And so a lot of times, if you've ever tried this, it's a nice little activity you can practice either in sitting, laying down. We want to calm the muscles up here. We don't want to breathe from our upper chest. We want to breathe from the diaphragm and from our belly. So as an exercise, you can always try this later. Put one hand on your upper chest, one hand on your belly here, and try to see if you can't get your belly and your diaphragm to expand, and try to calm the muscles that are up here. It's a great exercise to start practicing to try to breathe more deeply. Okay? Something you can try at home. You can try it now. Feel free. The MS hug or girdle pain. I don't know if we've talked a lot about that today. But in general, when we have pain, especially if it's in a region that's sort of in our abdominal area, we tend to start to go into flexion patterns. We want to kind of muscle guard, kind of protect ourselves. One of the best things that we can do is actually start to move again, okay? In general, stretching, we'll talk more about some other treatments later, but movement is just really the big idea in trying to manage some of that pain. Conventional treatments given by physical therapists, stretching. So I really wanted to go back and look at the research with regards to stretching. In 2008, there was a systematic review done on several studies on stretching over many, many years. In general, the review was basically kind of inconclusive. There are so many types and ways to stretch, different amounts and frequencies, but one thing that really stuck in my mind is that some of the studies were showing that the positive immediate effects of one stretching session can be very beneficial. But what does that mean for us? Stretching needs to be done frequently. The effects are usually very temporary. With any of my folks that deal with pain, spasticity, I want people stretching at least 3 times a day. But I did go to a course several years ago on spasticity management, and that point right there is one that I truly hit with all of my patients, is that the effects of stretching may only last 2 to 4 hours. We need to do it frequently. I've seen the immediate effects of stretching happen in the clinic in ways that even boggle my mind. So for example, one of the main muscle groups that tends to have a lot of spasticity in MS is the quadriceps muscle, the one right here on top of your thigh. It straightens your knee, which obviously can be very problematic for gait. That knee wants to stay straight in the swing cycle, you're kicking that leg around, it's not bending. I've seen where we do some quadriceps stretching on the mat, for several minutes. We get up, and almost immediately that person is walking faster and more smoothly, and they're like, wow, I can't believe how much better I'm walking. And so, if you come to therapy, we're certainly going to try to pick out some of those main muscle groups that tend to have a lot of spasticity. We want to help you manage your spasticity, move better, have less pain. Some of the modalities that we use in physical therapy, so ultrasound is maybe one that you've heard of. It involves a sound head that transmits sound waves to get slightly deeper kind of vibration and heat to some of the tissues. There's some evidence that does support that for pain control. We can usually do that up to maybe like 6 to 8 treatments, and then insurance, gets a little funny, but it's certainly a nice treatment to start with to see if it can't help improve blood flow and get some healing. Electrical stimulation. Has anyone ever tried a TENS unit for pain control? Several people. Have any of you had good success with it? Great. Very good. So transcutaneous electrical neurostimulation, electrodes that get placed on your skin in key areas that are causing pain, and it transmits electrical currents. It's basically a way to modulate or suppress pain signals in the brain. What's really nice about it, you can actually wear it, under your clothing. You can kind of, put the little battery pack like on your pants, in your purse. You can keep it close to you, and no one even has to know that you're wearing them. You can wear them as often during, daytime hours as you'd like to. So that can be a very good pain control technique. The use of hot and cold, which if you have, we obviously know that MS has a heat-sensitive component. Does it mean that you can't use heat for pain control? Absolutely not. If it's something that you prefer and you use it on a small area of the body, there has never been shown any negative effects of using heat from time to time for pain control. Strengthening and reconditioning is definitely one of the big parts of physical therapy. Postural retraining. You can see this, I love this picture down here of the person sitting at their workstation. One of my favorite concepts with posture is, if you're looking at a room just like this of people that are sitting attentively when the presentation or lecture starts, and you start to look at that room, even 30 minutes later, people are sitting to one side, they're slumped over, posterior tilt. A lot of us don't have very good postural endurance. It is something you have to work at. And even if you get fatigued, I really recommend for people to scooch yourself back in that chair with the backrest, get your pelvis positioned correctly, use that backrest for support. It's a good fatigue management strategy as well. Desensitization and sensory retraining is something that we also do both in physical therapy and occupational therapy. It's the use of trying to calm down some of those improper nerve signals, kind of give the body something else to experience, to try to override and reteach those those nerve fibers to start to calm down a little bit. Conventional treatments ongoing, so equipment trials and evaluations, braces, gait equipment, scooters, wheelchairs, cushions. One of the biggest things that I have learned as a physical therapist over the last few years from my patients is that with MS, some of the changes can happen so slowly over time that things maybe become a problem before you even realize it. And that is one reason that Dr. Green and Dr. Rauschway are such big advocates of that yearly PT-OT evaluation, is let's do a checkup and see if there's some things that have changed that we're not quite aware of, that don't seem like perfectly immediate in front of us. Let's take a look. What's different? What can we do differently? Okay. Manual therapy is a big part of pain control for physical therapists. Massage, trigger point, tender point release. I love myofascial release. We have a few therapists in our system that are very highly trained in myofascial techniques, mobilizations, distraction, functional activities, looking at your body mechanics. How are you moving? We're very commonly asking people, okay, show me how you do this. Where's the problem area? Let's see if we can fix it. Gait training, movement analysis. I do believe in exercise as medicine. There's several ways that you can certainly get exercise. With pain control, I'm a big advocate of yoga, tai chi, different forms of exercise that get you moving more smoothly and that have a relaxation and even breathing component to exercise. So fascia is a layer of tissue that runs continuously throughout our body. I kind of hate to use this example, but it's the best I can think of. When you're taking a chicken apart, that white kind of, layer, does that kind of make sense? Like when you're kind of pulling that, yeah. So that kind of runs continuously throughout our body. And different areas can still get restricted. And so some of the different techniques, that I've used in the clinic, suboccipital release, it involves the muscles and the tissue that are right here, like on the base of the skull. I use that a lot for headache management and tension. I'm a big fan of, this sounds so basic, but it's called a leg pull. With MS patients that have that just diffuse, heavy pain, there's techniques in kind of distracting the leg to kind of get a release, and people will feel it not only in the leg, sometimes they'll feel it, the low back, the upper back, and even into the back of the head. Just that's how tight some of those tissues can get over time. And we have fascia that runs throughout our body. So less conventional treatments performed by physical therapists, relaxation training, body awareness, diaphragmatic breathing, biofeedback. Carla and Courtney, who work at our clinic, they do biofeedback training. Nowadays, it's typically MDs that give this type of treatment. So biofeedback is the use of electronic monitoring of a normally autonomic bodily function in order to train someone to acquire voluntary control of that function. So things like heart rate, breathing, sweat glands, brain waves, temperature. It's using your own thoughts to control your body. The limited experience that I have with this, we used electrodes placed on a lot of my classmates, like the upper trap muscle up here that gets very tight. And so by using auditory feedback, we had to use our thoughts to turn off that incessant beeping noise to try to calm those muscles in order to relax. That's just one example. There's certainly alternative medicine, acupuncture, dry needling, bee stings, healing touch. The research doesn't strongly support a lot of these methods, but it doesn't mean that it can't work for you. There's no harm in trying a lot of these different techniques. But do talk to your doctor about how they feel about those different treatments. MS-related pain management, spasticity. The best practice for managing spasticity is a comprehensive approach. A lot of times, medication, stretching, strengthening. I think Dr. Green mentioned this a little bit. In severe cases, we might be looking at Botox, baclofen pump, surgery. But not in all cases. Usually conservative measures do manage spasticity well enough. Postural alignment, body mechanics, that's very individual. We want to see you in the clinic to see what your individual needs are. Equipment, positioning needs, we'll talk about that more. One thing I also want people to take away as a message here today is to be very, so red flags, quick fixes. In the evening when I'm watching TV with my husband and these infomercials come up for do you have Medicare? Then this knee brace is for you. And we both, he's a physical therapist as well. And so we're like, oh no, what now? What's the next quick fix for this type of pain problem. And they're certainly appealing to our needs. They know that pain is a big deal, but I do encourage people to seek out a more comprehensive approach. A few patient examples I want to bring up today. Susan is a patient I've treated for several years. She has chronic and acute low back pain. Some different treatments that we've used for her that have been successful. She has acquired a walk aid. If you're familiar with a walk aid, it's the electrical stimulation that helps with foot drop. She does daily strengthening and stretching. She's one that truly does stretch 3 to 5 times a day. But what I really want to encourage people, say you've had therapy before. I know I see a lot of familiar faces here. If your exercises were helpful in therapy, get those exercises back out again. There's a good chance they're going to help you feel better, okay? Additional services that she has sought out: chiropractor, massage, gait and body mechanics training. She uses her cane from time to time. Assisted devices can not only be used for weakness and for balance, but they can also be used for pain management. When you use an assisted device, it does unweight your legs at least to a certain percentage. And so you can use those devices to also help manage your pain. Cheryl's another one of my patients that also suffers from acute and low back pain. She also has paresthesias of her toes, her feet. Some successful treatments that we have used: spinal decompression. I'm a big fan of a certain position that I give a lot of my patients that have low back pain. It's a position where you lie either on the ground or on a bed in what's called 90-90. So you're on your back, your thighs are vertical, your calves are horizontal this way. You can do that position by maybe putting your calves on an ottoman, on the sofa, depends on where you feel most comfortable. If you're not comfortable getting on the floor, you can always have someone help you get an ottoman up onto the bed. I love putting a cold pack under your low back in that position, and then as an even bonus, doing some posterior pelvic tilts in that position as well. You can accomplish so many things from that position. I know a lot of people that have gotten a lot of success with their back pain management by using that technique from time to time. And just like I mentioned earlier, starting her exercise program again certainly helps her feel better as well. And so I tried to have Cheryl show me her before gait, and if you can try to see, she's really dragging that leg along. She's getting pelvic rotation. I mean, the leg is not really with her. It is sort of being dragged behind her. What I want you to see, though, is that after strengthening some different gait cues, some things that I was telling her, pretend like your kneecap is on a string. We want to try to bring that leg under your body in the sagittal plane. And she's like, I'm always thinking about my kneecap now, and man, it has really helped my gait. She's getting a longer stride. She's getting less twisting of her body. You can kind of see. But everyone's gait is different. And is our goal in MS gait to have perfect and beautiful gait? No, but we certainly can make it a whole lot better and help you use better symmetry, better muscular control. Sherry is another one of my patients. She's more new to me. She's been more recently diagnosed with MS. Her pain in her legs was probably a 7 to 8 out of 10 when she first started coming in. Within 2 appointments, her pain was down to a 0 to 1. And honestly, I think the stretching was the biggest part of her pain relief. And one thing I'm really trying to do more often is have a combination of stretching techniques. And what I mean by that is having the person with MS have your own stretching, your self-stretching exercises, and then maybe having a care partner, family member help you with stretches on other days of the week with a goal of maybe 3 to 4 days a week. Stretching is supposed to be passive. It's kind of hard to be passive when you're cranking on your leg with a belt. So I do like that if someone's able to help you with stretching, it can allow you a chance to relax and go further in your range of motion than you would otherwise. Myofascial release worked really, really well for her, getting started in an exercise program. And then honestly, she had come from a different healthcare facility, come to the MS Center, and she was just so pleased with the comprehensive treatment that she was getting from the doctors and the nurses. I think that also helped manage her pain as well. She felt like her needs were finally being met. Priscilla is another one of my patients. She's had several different types of pain disorders over the years. Upper back tightness, extensor weakness, low back pain, plantar fasciitis was a new one that has kind of popped up, and then even hallux, which is like big toe pain. We've done manual therapy, specific exercises for the plantar fasciitis, core strength, spasticity management, cold therapy, a lot of things that we already talked about. She's also a walk aid user as well. We also came back and adjusted her orthotics. That was causing her some pain. Updated exercise program, again, that idea that your needs might change over time, and we want to make sure that you're doing the exercises that are specifically designed for where you are with your MS at any given point. She also uses a personal trainer for ongoing exercise, and so she's been a definite positive example of pain management over the years. Joan is another one of my patients. She has an interesting combination of orthopedic and arthritis and neurological spasticity-based pain. We've used ultrasound, stretching. She's a former speech pathologist, so she comes in with her list of questions, and I mean, she is so organized. Her exercise program is so detailed. I'm talking Monday through Friday, exactly what time she's exercising, how many reps, how many minutes, and she's on her game. And we've taught her spouse how to help her stretch as well. You can certainly read a little bit of what she's shared with us today. I wanted to also share a little bit about some of our specialized services that we offer at Mercy. Kathy is one of our seating and positioning specialists. Mackenzie Gordon is also one of our PTs. Some of the thoughts that she wanted to share with us today with regards to pain management. A few key points. You can certainly read further into the details. Making sure your cushion, if you are a cushion user, is seated correctly. Your cushion, definitely, if you have an inflatable cushion, that it's being inflated properly. And she even mentions that Roho has videos online that you can access in order to make sure that your cushion is inflated properly. Number 3 is a really, really, really good point. Doing pressure reliefs frequently. And this even goes, say you're someone that is very ambulatory, it's still good to remember that we need to change our position every 30 minutes for at least 30 to 60 seconds in order to really relieve those tissues and promote blood flow and good positioning. And that's actually probably more frequently than what you would even think would be necessary, but that is the standard in physical therapy. So there are a lot of cushions available. She does an individual evaluation. We want to make sure that you're using the right equipment for you. There are a lot of different therapeutic backs available. I do recommend for people, when it comes to wheelchairs, the manual wheelchair that has a sling seat and a sling back is only meant to be used for about 30 to 60 minutes maximum for seating. If you spend more time than that in a seated position, you either need a cushion, a more supportive backrest, or we need to get up and moving. Those wheelchairs are really only meant to be more for like transportation purposes. A lot of times insurance will cover the majority, if not the entire cost of backrests wheelchair seating, so it is something to look into. If a client has more significant postural deviations, there are custom molded backrests that are available for use as well. Tricia Becker is one of our therapists at our satellite clinics that does a lot of pain management. She's also worked at our Holistic Health Center, which is also another location I wanted to bring up today. In her experience, she has seen positive results from myofascial release. And she describes it a little bit better here for you. It involves applying a gentle, sustained pressure to the myofascial connective tissue. This low load allows connective tissue to elongate and release painful restrictions, and there are studies that have shown positive results in MS patients. Courtney and Carla are two men's health therapists. Carla's actually presented for the MS Center before. I think several of you have attended her talks. There's a lot of different ways that they can help you with your pain. They look at the pelvic floor. You can certainly have spasticity in the muscles of your pelvic floor as well. There's different techniques and modalities that we can use to help that, as well as better positions for sleep, intercourse, restroom use. Treatments are very similar to conventional therapy, but it also is more specific in regards to what they do in their specialty area. I wanted to look up a little bit on MS pain and research. What I keep seeing across the board is, like Dr. Green and Dr. Rausch talked about, is a comprehensive approach to pain management, interdisciplinary approach. I found a few interesting articles on hydrotherapy. With this particular study, they actually compared like Tai Chi, I Chi exercise. That was the experiment group. And the control group did abdominal breathing, they did contract, relax exercises, and the experimental group, the Tai Chi, I Chi exercise group, showed the best results in pain control over the 10 weeks. And they even showed ongoing pain management even after the study was over for an additional 10 weeks as well. So they looked at exercise and massage and its role in pain management and other functional abilities. The massage group actually showed the best results, even better than just the exercise group alone. But I will say the massage and exercise group showed the most positive gains. And I will say, even in my own practice, when you come into therapy, are we only going to do massage for 60 minutes? Probably not. We want to make sure that we're obviously doing manual skills to help get the tissue to move and improve blood flow, but we want to see you work as well. So it's important to do exercises to also stabilize and gain that muscular control of the different areas that might be weak. So some take-home messages today. We don't want people to just live with pain. We want to look at a comprehensive but individual approach to your pain. What things are you doing to actively manage your pain? What has worked in the past? What hasn't worked? Again, if you've got some old exercises, maybe pull those out again, or come see us again. We talked about quick fixes, checking your posture and alignment. I've got a picture here of my daughter. She's unfortunately the daughter of 2 physical therapists. So one day she's reading her Harry Potter book in the front room, and she's like, "Mom, my back hurts." And I say, "Teresa, go fix your posture." And so, a few minutes went by, I go back into the room, and this is what she has done. She's grabbed a pillow, she's placed it conveniently behind her back to get her spine more vertical, and she's placed that pillow underneath her book to bring it up to closer to eye level. So she did that with very minimal prompts. I was very proud of her. With your equipment, is your current equipment meeting your current needs? Do we need to see you for a replacement, an upgrade, a tune-up? In order to seek PT/OT services, we just need a prescription from your doctor. It doesn't have to be your neurologist, it can be your primary care, any other doctor that's willing to follow your care along. And as an ongoing goal is self-management. This is a picture of some of the therapists that work at our location. We are considered a partner in MS Care with the MS Society. You can certainly contact me personally by email or phone number. I think that's it for today. So I think at this time we'll probably take questions if people would like to write those down on paper. Thank you. Okay.
How many of you have pursued physical therapy? Yeah. We really encourage that. Our body, we sometimes are deceiving ourselves that we don't know that we're out of gait or not doing things properly. So, any questions on cards?
I've got one here. So the first one here, aquatherapy, where available, and they're looking for specific water heights and such. The MS Connection magazine, which comes out both as an electronic email and a paper copy. It does list a whole slew of different aquatic therapy locations throughout the St. Louis area. You should be able to find that online, but through MS Connection, you should be able to find that information. She was asking about Pilates for MS.
Pilates for people who have
MS. I can't say that I'm aware of any specific classes that are specific.
This from somebody who knows about
MS. I do feel like the MS Society would be a good place to start. And I know the MS Society has tried to mainstream some of their services where when you call like their 1-800 number, they're going to try to find the right services for you in this area. I would try there first, and then if you're not finding what you're looking for, by all means, shoot me an email. I can certainly help you look for those things, but I would look through the MS Society first. Would a float tub be a beneficial treatment to help? There's another question: would a float tub be a beneficial treatment to help relax strain and pressure? I'm not sure if I know what a float tub is. Is that you?
They have those magnesium floats like St. Louis float,
I apologize. I don't know enough about the float tubs. Do you have a little bit of?
It's Epsom salt, like it's insanely dense.
Okay. Okay, I have heard of like Epsom salt kind of baths. I can't say that I know a lot about like any type of research or anything, but it's certainly worth a try. And that's one thing, just to continue to seek out all different measures to see what works for you. But I don't know enough about that. I apologize. All right. The need to stretch my face out, eyes, mouth, MS related best way. I'm really glad someone brought up facial tightness and pain. So we also have therapists at our location that do facial retraining, and there are certainly exercises and stretches that you can do to start to relax some of the different muscles of the face. I even have a friend that I referred to this program for that same reason. So we do have therapists that treat facial related impairments. So. Any other questions?
I know that's not.
It's okay, no. So I have an independent project that I have been working on in the past year. It is not Mercy related, but what I have done is taken some of the exercises that we do in my MS exercise class, and I do have them on a YouTube channel. The good news is it is supported by the MS Society. If you go to the MS Society's main website and under exercise resources, you will see Chair Fit with Nancy.
All right.
Thank you.
Yes.
I appreciate it.
Great.